afternoon, everyone.
Good afternoon.
Would you like this form? Oh, okay, thank you. Welcome to our Focus Forum. For those of you who don't know, I'm Rita Reichert, President of the Board of FOCUS, and just delighted to see people in the room as well as those we have folks online. So welcome. Today's topic is health services access with a focus on the uninsured. Our panel of experts will explore how being uninsured affects overall well-being, stability, shaping overall access to health care, employment security, family stability, and vulnerability to addiction. We're thrilled to have three panelists here today who have slightly different perspectives on the issue. In alphabetical order, they are Yolanda Turbini, is Divisional Director of Community-Based Services at Liberty Resources. In her role, Yolanda oversees non-clinical services provided by Liberty's Certified Community Behavioral Health Center and its adult and children's health homes programs. She has over a decade of experience in community-based behavioral health, including supporting individuals and families who face gaps in health coverage, housing stability, and barriers to coordinated care. Next, alphabetically, Kevin Jenwick is Vice President of Programs at the Health Foundation for Western and Central New York. In his role, Kevin supervises the Foundation's program team as they work to develop and implement community partnerships and programs that support the Health Foundation's mission and vision. Kevin also develops and supports programs that recognize and address the unique challenges and needs of caregivers of older adults. He brings to the Foundation a unique perspective on aging and caregiving and its impact on both people and systems. For some of that, that's getting closer and closer to the and then we have Alex Pizarro. She's Director of Operations here at Syracuse Community Health. In her role as Director of Operations, Alexandra assists in the collaboration of 13 sites of services. A handful, but more than a handful. Previous to her appointment as Director of Operations, Alexandria worked with the Syracuse school-based health centers in the district. Okay, we're going to go from my right to left. So Yolanda, you're up first.
Hi, everybody, and thank you for that introduction. I'll start off by sharing a little bit about my organization and how we're structured and how we help with access in the community. Liberty Resources is an organization, a nonprofit that serves over 18,000 individuals across New York State, Indiana, Texas, and our services are on the continuum. So we are focused on primary care, behavioral health, SUD services, outpatients, our supportive services, which are the services that I oversee that I'll tell you a little bit more about. And the rest of our organization has an array of services that serve children and families. They serve intellectual disabilities and developmental disability population, and also those who experience vision and hearing loss and early intervention childhood services, so OT, PT, and AD. So we really have an array of services within our organization. My area in particular is our Certified Community Behavioral Health Center, or CCBHC, which is also an FQHC, a federally qualified health center. Essentially, that's just primary care behavioral health. That is at our 1045 James Street office. And I think when we talk about access, making sure that people have a place to go where they don't have to go everywhere in the community for services can be really, really helpful and help people engage in their care. During our same-day access, which is the single point of access for services to our organization, that occurs Monday to Thursday, 9 to 3, and on Fridays from 9 to noon. Anybody can walk in. You don't need referral. Walk in and they'll meet with one of my staff, a TCM or a peer support, and they'll sit down. We'll talk about what their needs are. They'll talk about why they're there and get some support. I think what we find in our community is that systems can be complex. It can be difficult to navigate. People come to us overwhelmed, and they come to us sometimes untrustworthy because of their previous experiences. So having a place where somebody like a peer support can talk to you about services who has lived experience can be very helpful and supportive through the process. So while they're meeting with the non-clinical staff, they'll be assessed. We do an assessment called a repair, which goes over our social determinants of health. So areas like housing, education, food insecurity, financial, all those areas to determine the things that may be preventing them from focusing on their care. So we're addressing the whole person, and that is a place where we try to identify what services might be needed and partner with the client and developing a plan that will work for them. In addition to that, during the SDA process, they'll have a nurse monitoring appointment. So we're focused on the whole person, know their vitals. We'll also do an SUD screening. So we're making sure that we're addressing all needs. And then finally, they would meet with a therapist. If they're interested in behavioral health services, they will have an intake. If they're interested in establishing primary care, they can also see a primary care provider. So essentially, our SDA process is really to identify what needs there are, partner with the client, provide them with support, and make sure that they have a connection to care. In terms of the underinsured, our CCD does not turn anyone away. So if you don't have insurance, underinsured, you will receive services. We have sliding scale fees for individuals, but even if you didn't have money, you will still receive services and support in obtaining insurance. So we have providers on site that can help with applying through the change for healthcare insurance. So that's also a service that we provide. Our TCMs and non-clinical supports help them connect with external resources that our agency doesn't offer. So the model is really about wraparound support.
So my name is Alexandria Zarza. I'm the Director of Operations at Syracuse Community Health Center. Also Director of Performance Improvement. I'm a person that's worn many hats in my time here since 2022. So as stated, I used to oversee the school-based health centers. We have 8 clinics that provide medical, dental, and behavioral health in 5 middle schools. Excuse me, mixing my words up. 5 elementaries, 2 middle schools, and 1 high school. We have 26 total schools that we are participating in the Syracuse City School District that also provide dental exams to give an oral health assessment to students in the PEACE pre-K program, as well as some of those entry-level elementary schools like SAS, Lincoln, in order to close those care gaps on oral health for students. School-based health centers is really close to my heart and is still a robust program that we're a part of, where we're able to provide physicals, shots, and other diagnostic and treatment services right at the clinic itself, without the necessary presence of a parent unless they need to be, because of the credentials and consents that we've already had signed for them to be present at the school-based health center. A lot of those tend to trickle in through the nurse's office when it tends to be more complex diagnostics or needs. They can come to our health center to get full diagnostic treatments, assessments, shots, physicals, to kind of prepare them and set themselves up for a lot of those school-based activities like sports and going on field trips and really focusing on their education. A lot of what we found is that when individuals were taken out of school to go to a doctor's appointment, the truancy rate of them coming back was very, very less likely. It's more of a, you went to your doctor's appointment, you get McDonald's, and now you get to go home for the rest of the day. But we're trying to encourage kids to stay in school. The attendance and truancy of students leaving the classroom has been incredibly high in the previous years, especially post-2020. So our ambition to increase the students being present in schools also compounds with the fact of getting them in touch with healthcare. Where we feel that this is part of our mission statement is that it changes the tone for seeking medical care from a rudimentary age. So when you're developing and you tend to be a little bit nervous about doctors, or you tend to be a little bit scared about the dentist, if you engage with a healthcare professional early, you're more likely to engage with those healthcare professionals later on in life. when it ends up being less and less of a scary thing, it feels so much more accessible. I think one of the largest barriers to care that we feel in this community is both the access to health literacy information that is accessible and understandable by a wide variety of individuals, but also those that are in multiple languages, or those that allow us to tap into resources that are not even local to us, but potentially collaborative partners outside of the city. So when you're allowing students to engage in that healthcare system early, they're more likely to keep up with those appointments. After about 16 months, I navigated outside of the school-based health centers and really got involved with all of our clinics. Through Director of Operations, I helped oversee the dental department for 6 months. Our dental program has dentures, fillings, cleanings, prophies, sealants. We don't do orthodontics. And we have limited abilities for certain like numbing and anesthetic, anesthesiology. Not the app. We got limited options for that. So even though we have services that can really get you on that dental healthcare process, there's certain extensive services that we may refer you out. But it allows you to bridge that gap between not getting any dental services at all and being able to have a dental home that can refer you more to those complex cases like root canals or otherwise braces is something that comes to mind. After I oversaw the dental clinic for about 6 months, I went into Director of Facilities and Security, and I worked to bring our housekeeping staff on site so that way they were a part of our sort of mission statement, part of our benefit program. We weren't utilizing an outside resource anymore, and really what it did was kind of give that warm touch of our mission statement to all levels of our staff. So that way there were opportunities of growth. They had our PTO, our benefits, our plans, and then we had our warm touch from a management to a staff perspective, rather than trying to work from a staff perspective up to a management that wasn't necessarily present on site. After I brought housekeeping back on site and was kind of looking at our security for our 4 main buildings, we're located here at 930 South Salina Street. Our home base before was 819 South Salina Street, and my other 2 locations that we have security at are 603 West Oswego and over on East Fayette, right outside of between Erie Boulevard and Westcott Street. So we're kind of in a lot of different pockets. The only pocket we're really not present in is the north side, where we have school-based health centers like Franklin Elementary, Grant Boulevard, or Grant Middle School, but we don't have a clinic on there, so it's one of our untapped in resources. But there's a lot of different options that people come to us, and all of them have different opportunities too, since we serve the community. And we're serving a community that may be presenting themselves not as their best self, having that presence of just an individual that is there and stoic and ready to help, kind of offers that sort of quietness into some of our smaller meeting rooms. After I was president there, I was navigated to health information management in the absence of that director. So I helped oversee our health information management team and what that collaboration looks like when a patient comes in to receive the records, both from a digital aspect and from an in-person aspect. What I've noticed recently with accessibility to digital systems is that a lot of healthcare systems have gone towards AI. And we utilize AI in some capacity, but that warm in-person touch, whether it's via the phone or receiving your records through another individual, has been something that's been highly requested and asked of from our current population. So we really try and keep that robust. We have front-end desk staff that generally speak multiple languages that can help individuals. We also utilize Propio that helps with, I think, 206 different language options. So you not only have that warm contact when you're trying to get in touch with us in person, but we're trying to have that warm contact on the phone as well, that if we're not answering your call at the first ring, that we're following up with your voicemail. So post HIM, I've done school-based health, dental, security facilities, HIM, and now I'm front desk. So I'm a little bit of a jade of all trades. The front desk is really our core system. They're the Harvey Boys or the Nancy Drews of the healthcare practice. They are the start of the patient medical record and the start of the patient journey. Your first interaction with the front desk staff, no matter where you go, is going to make or break that initial relationship of what keeps you at a healthcare facility. That cordial reception, that neutrality, not too high, or hey, how you doing, and not too low, what are you doing? is really that sort of sweet spot to engage in you as a patient, to be able to receive what you have going on, and to not place it onto you to be able to manage your emotions when you're just trying to check into an appointment. And really what we're seeking here is to not only hire members of the community so that way they can be reflective of the neighbors that we're serving, but also hire members of the community that are showing this sort of TLC that we so desperately need. That accessibility to healthcare can feel isolating and disenfranchising and really hard to navigate. Insurances can be hard to navigate, going through different resources or different programs can be hard to navigate. Sometimes there's court credentials that are involved of what you need to get signed off on, or state credentials involved that you need to get signed off on in order to keep your housing, in order to keep your benefits, in order to keep maintaining a sort of quality of life that is beneficial to you. So what we really strive to do is gather all of that information at the front desk and guide it to the appropriate resources. What I tell my team is that they're not going to be the subject matter experts in anything but the forms that they're given. And everything else, they have to tap in with another resource. And they can't assume that they know everything. They have to assume that they really know nothing and gather things as they come at them so that way they can deliver the message clearly and unbiased without any sort of opinions of their own that are attached to it. Because they're the receivers of the information. The patient that's in front of them, whatever they're telling you, is their subjective experience of their perception. So one of the ambitions that I have in this role is really giving that sort of warm touch to the community and bring people back into a federally qualified community health center. Because since our start in the 1970s, there's been a focus in recent years towards privatized medicine, privatized hospitals, commercial insurances. And I would love to revitalize and robust the image that we have as a community health center and bring back that focus in you have a health home right at your doorstep, that you don't have to go 2-3 hours out just to get accessibility to healthcare. And that your accessibility to healthcare, whether it's in this brand new building or in the old building across the street, because we're opening up additional clinics over there, family medicine is being navigated back over there. We don't want someone to go over to the old building and go, oh, I'm at the old building. We want it to feel just as fresh and nice as when they come over here. So those are really where my passions lie. To speak on some of the practices before I hand it off to Ken. With our 13 different departments, we go from cradle to grave. So we have OBGYN, pediatrics, family medicine, internal medicine as in podiatry and nutrition. We also specialize in eye care and dental. We partner with Quest Laboratory. We partner with Blueprint 13 across the street. We have Care Coordination across the street, Quick Care, Family Planning over the West Clinic, as well as Family Medicine and Global Health in the West Clinic. And then over at our East Clinic, we now have dental, behavioral health, and family medicine. So no matter where you go to at our locations, we're looking to give you those holistic options to care. And one of the messages that I love to deliver to people whenever I'm a part of these events is that we spend a lot of time focusing on the people around us and establishing the care for them. And while you're here today and listening to us and we're listening to you, I would love for everyone to kind of tap into themselves and think about what levels of care have you not looked into for your own self, whether it's a headache, a tummy ache, you've got this weird click in your thumb that you've been managing, what have you not tapped into for yourself? Because we spend a lot of time looking elsewhere on how we can help each other and help our family members seek care, or say, you know, your tooth's been ready for a while, you gotta go to the dentist. But we don't often budget that time out for ourselves to go to. So I always want to encourage that because sometimes it can be a little while and then we reflect and we go, oh shoot, it's been a minute since I've been to the dentist. Or, you know, I haven't checked in with a therapist or a mental health provider in a while and I've gone through big life changes. Or, you know, my family member has said that they've had this health diagnosis recently, maybe I need to get checked out to see if I have biomarkers for it. It can be very interesting too because your neighbors can be reflective of your own health. When we look at the construction for 81, when we look at the lead that's in our soils, when we look at the construction that's happening for the aquarium or at the mall, a lot of those are near our local water resources. So if you're tapped into your community and your neighbors and you see these health disparities coming up for others, it's always good to tap into it for yourself too. We're the only ones that can be in charge of our own autonomy and our own body. So it's good that we're looking out for others, but we do have to tap into ourselves as well.
Thanks. Thank you. Go ahead.
Appreciate it. Well, good afternoon, everyone. I gotta say, first of all, I could listen all day to both of you talk. I mean, I'm really impressed with both of your organizations, and it's just really great to hear about all the services that are available in Onondaga and county as well as the city of Syracuse. So it's a pleasure to be here today on behalf of the Health Foundation for Western Central New York. Like I said, it really is great to be here today to share a little information about our foundation and hear from all of you. I'm going to talk a little bit about our foundation. I want to talk more about why we advocate for health insurance for all, as well as protecting the under and uninsured, which is really a focal point of our foundation, our advocacy. So just a bit about our foundation. We were formed in 2002, and since then we focused on improving the health of people in the 16 counties of Western and Central New York, with a focus on children 0 to 5, as well as pregnant people and maternal health, as well as older adults and their caregivers. And we do that through strategic partnerships and grant funding. I see some funding partners in our room today, as well as strategic work with community partners and initiatives and advocacy with a vision of a healthy Central and Western New York, where racial and social economic equity are prioritized so all people can reach their full potential and achieve equitable health outcomes. That's our vision. And of course, healthcare is central to that. So at the Health Foundation, we believe that healthcare is a human right, and we advocate for quality, affordable care, and support initiatives that make our healthcare system more accessible and effective. And we advocate because we know that in order to improve the health of the people we serve, we must first address the policies, laws, and regulations that contribute to community health outcomes. There's extensive evidence, and I'm sure you all know, that demonstrates how having high quality insurance coverage is associated with better health outcomes. But conversely, when more people are uninsured, there's a ripple effect on our healthcare system and the community's health. Uninsured people are far more likely to delay preventative care, like I was talking about, dental services and others, putting them at a higher risk for acute or chronic illnesses that are often more severe and expensive. We know they're also more likely to seek care at the emergency room, which is less effective for the individual, and also puts an added strain on health systems that aren't equipped for that influx. So that's why we work with community partners, like many of you, to address changes to healthcare access that are coming out of HR 1, otherwise known as One Big Beautiful Bill. And it's estimated that changes to eligibility could put more than 1 million New Yorkers at risk of losing their coverage, including those currently covered by the Essential Plan or Medicaid. So as the impact of these changes, which are, we were talking earlier, which are constant and shifting, as they continue to unfold, we're likely to see higher wait times, higher costs, and less availability of high quality care for more people, even beyond the uninsured. And we know there are various groups of people that are at risk, and that includes family caregivers that was talked about earlier, which is over 4 million New Yorkers are providing care for a loved one, regardless of their age. And I always like to do this, but with show of hands of anyone who's a caregiver or provides care for a loved one, whether it be a child, youth, or older adult. I think of Rosalind Carter, former First Lady, who said there's 4 types of people in this world: those who are caregivers, those who have been caregivers, those who will be caregivers, those who will need a caregiver. So I think that pretty much covers everyone. And we know that with HR 1 and the changing workforce requirements that are going to be starting in January of 2027, family caregivers can become exempt from work requirements, but they're going to have to confirm the ability to receive that. And right now, all states are required to write a definition of what constitutes a caregiver, and we are really advocating so that that definition is as broad as inclusive as possible, so all caregivers can be exempt, from work requirements, particularly those of older adults. And we know that older adults are at risk too, as more than 700,000 people in New York are considered dual eligibles, otherwise eligible for both Medicaid and Medicare. And in addition to the harm caused to Medicaid enrollees, the organizations that serve them are also set to take a serious hit when these changes happen. Nonprofits, social and healthcare systems, federal qualified health centers, will suffer great financial strain with fewer people enrolled in health coverage. And we know that, I say 42% of New York State FQHC funding comes from Medicaid. So we know the impact that this can have. And the impact that healthcare providers can have on everyone, regardless of their health insurance coverage. Currently, New York State, we know, is encouraging Medicaid enrollees to visit your New York State of Health website to find more information and sign up for updates so that people can be prepared for what changes are happening and when they take effect. So that's a little bit about our foundation, but really why this work is so important to us. We do encourage all of you to learn more about the advocacy that we are doing. Go to visit our webpage and go to our advocacy page at hfwcny.org. Thank you.
Thank you, Ken. All right, the fun part now. We get to talk about insurance. Not insurance, excuse me. Talk about, some of it will be about insurance, but talking about some of the questions that have been submitted and if we have any others from the audience. But let me start with a couple of questions. Now, for anyone who wants to address this, what are the biggest barriers preventing people from getting coverage?
I think that one of the biggest barriers is access, not knowing where to go. We talked about the complexity of the systems. Applying for health insurance through the exchange is not a simple process. They may not have access to the internet. All of those things can be barriers. So I think that that is one of the biggest barriers, and that's why it's great to have organizations that have people that can support navigating the process. And also helping people, get insurance. I think that's helpful. And also another area is that people can be very, I think, based on their experiences, trusting and providing support. I find that helps people stay engaged. They're more likely to then engage in the services, follow through. So those are some of the barriers I see, and I think also the complexity of the policies. Just was mentioned, the one big beautiful bill is placing some additional requirements to keep your insurance. So if you're unsure or not aware of these things, keeping up with it and having the supports to do that can be really helpful. I know one of the things that we'll be doing in our programming is making sure that people are aware of their coverage dates. Also, if they do need to seek out employment or a volunteer service, we can support with that. So that hasn't become a barrier to having care.
This might seem a little too broad, but I would say life. Life gets in the way. All the time, life gets in the way. A lot of what I do with our patient population or with anyone, when I am checking and I'm at the front desk, I'm the boots on the ground. Is someone gives me their 2 patient identifiers, what's your name and date of birth, and I look them up and I go, oh, I found you right here. Nice to meet you. I'm so happy you were able to come in today. And I usually get this, oh, God, I'm happy I'm here too. Because they've been waiting for the appointment. They've missed other appointments. Other things have gotten involved where they weren't able to really meet that connection. I always tell people it's so much easier to do nothing than it is to do something. We always have that moment where we're trying to roll out of bed, where we're trying to brush our teeth, where we really don't want to pick out the outfit for the day. And I commend my staff daily on the ability to just show up to your job, but it really goes to the patients to be able to show up to their appointment. They're not getting paid for it. And their 15 minutes to an hour here is completely different than my staff's 8 hours here. And it's in a different context. They're thinking different things. They have other challenges going on. And when it specifically comes to healthcare and gaining that accessibility to your healthcare, it's all of the barriers that Yolanda mentioned and that I'm sure Ken will bring up too. It's childcare, it's transportation, is your job going to give you enough time to be able to go to the appointment? Because a lot of jobs are open 9 to 5, and then your doctor's office is open 9 to 5. Is telemedicine available or accessible, or do you even want it? Maybe your doctor's pushing for telemedicine therapy appointments, but you really want an in-person session. There's all of these sort of barriers that can limit us going to those appointments. Is the appointment going to bring you pain? Is the appointment going to bring you a uncomfortable diagnostic procedure or a procedure that's going to require recovery time? All of these things get in the way of people choosing to access the care because a lot of times it's, oh, I'll do it later. And I know I've had this headache for like 3 weeks and it's making me dizzy every time I bend over, but I really can't take the time to do a sleep study. These are the things that really get in the way of people accessing care. And I think the way that we combat it as an ambulatory outpatient health center, because I don't have sleep studies, you come in here, you're leaving at the end of the day. It's outpatient, it's ambulatory. So what we do is when we're doing our confirmation calls, we really put that TLC back into, do you prefer a morning or an afternoon appointment? Because then they get the opportunity to say, you know, I take care of my mom, or I have to pick up my kids at this time, or I'm in class. So that way we're able to adapt the schedule to their needs rather than them forcing to adapt their schedule to our needs. We see a lot better show rates when that occurs, when we put in the patient preferences for their appointment times. But we also ask them too, do you have a good means of transportation to get to your appointment today? Or if they're in for an eye exam, it's going to require dilation. You know, your eye exam may require you to have blurry vision for 12 to 24 hours. Do you have someone that can come with you to that appointment so that way they can bring you home? Those are the types of inquiries and questions that not every healthcare practice, I think, always makes, but it allows a more robust system and allows the patient to feel like they're cared about. I receive on the phone almost this, you can tell in the tone of their voice that not a lot of people are asking them what's going on in their life that's causing those barriers to care. And so when I ask them, you know, do you prefer mornings or afternoons? They go, oh, really afternoons if I could. And it's almost like they're begging us for the ability to meet their need. Because of the lack of ability, other agencies or centers or the system at large, I'll say the system at large has given people not necessarily the opportunity like healthcare is accessible for them. So when you make healthcare accessible for them by reaching out and going to community practices or community events, Jazz in the City, where you show up to panels like these, where you say, you know, here's your resource, here's your phone number, where you get in touch with that person, they go, you know what, here's my extension. So I can follow up on your care. That's going to encourage you to come back. And when you have that receptionist that greets you with that neutral tone and says, I'm so good to meet you. And then after the third or fourth time that they see you, they're good to see you again. That establishes a rapport and a relationship that makes it really feel like a health home rather than just a health center.
Thank you. You know, I would just say a few things. You know, just you know, we're talking about what barriers are in coverage and care. And at a high level, and I talked a little about this earlier, it's affordability of healthcare for individuals, and it's access of plans that are appropriate for them. And everything that was talked about earlier, I mean, really speaks to the need for navigation. I mean, people need to be able to understand healthcare, what their options are, and that limits so many people's abilities to be able to find a health plan or healthcare coverage that can work for them. We commissioned a study in 2019 called Reaching 5%. We live in New York with all of the individuals uninsured. There was a large number of those people who were eligible for healthcare plans but did not register. And so, you know, through that report, it led to initiatives that we have supported as well as other funders across the state to be able to really invest in healthcare navigators that can help individuals, and that's from trusted community partners. And that's, I think, what Lonnie was talking about that earlier, is just how important it is, you know, not just to be able to have individuals that can help people figure out their healthcare needs, but people that they're going to trust and that can really help them understand what their needs are, you know, in that instance. So, you know, really it's being able to understand and navigate that system, which again is talked about earlier with changes happening with this one big beautiful bill, is making it even more difficult. So we know New York State is really looking to build that out, but it's gonna take more than the state. And it's gonna take, organizations, nonprofits in our communities that are gonna be able to help navigate that. I was very fortunate yesterday to attend a meeting for Early Childhood Alliance of Onondaga County, where they really launched the state of early childcare or early childhood in Onondaga County. And the speaker that was there talked about a new survey that they've been implementing called a rapid survey, where they're able to talk with families and get more like real-time data. You know how difficult it is sometimes to get really, credible and quick data. But they talked about with all of the services that are available in the community, what are reasons why individuals are enrolled in not only healthcare but also free programs. The number one reason is they don't know if they're eligible, right? And if they are eligible, they say that they couldn't complete the application, and the process is done. And so, we know how important it is for individuals to receive the care they need. But we also know the importance and how difficult it is for individuals to be able to navigate the system to be able to apply and receive those services.
I'm going to follow up on some of that, Ken, and start with you on this one. We had a question about Medicare. Is it comprehensive, or do you have to have supplementary?
I have not been expert about Medicare. But what I can tell you is yeah, so Medicare, the traditional Medicare is available for older adults, and it does have a few different components of it. There's Part A, which I believe is a hospital, right? Part B is the supplemental, and then there's also Part D, which is for prescription drugs. And also important to note that you do have your traditional Medicare, but then there's also Medicare Advantage plans, which is considered Part C, which is basically Medicare that's offered through private insurance companies. And so, so yes, they are comprehensive. But again, it's very important for older adults to understand which of those services are best for them. Because, and I'm sure, everyone or knows someone who's been getting calls and being reached out to by Medicare Advantage plans, really trying to offer and tell them, why their services are best. Again, I think it comes back to the importance of being able to have trusted partners, that can help an individual navigate what is best for them. Prior to coming to our foundation, I was a director for the Niagara County Office for the Aging. As I think you all may know, is that every county has an office for the aging that was really developed to be able to help offer older Americans Act services, which is up for reauthorization, which is super important because those are all home-based services to help older adults age independently in their homes and in the community. Those offices all have health insurance counselors, and when I was part of the Niagara County Office for the Aging, that was a huge focus of ours, was being able to make sure that we can help older adults and their families figure out what their needs are and make sure that they're enrolled in the best plans possible. Because that can be a mistake that some individuals can make, is that they're picking a plan or they're choosing something that's not really right for that.
Sorry,
The only thing I was going to add is echo Ken's accessibility to plans, and we have Melina and Fidelis that are frequently on site. And when it comes to comprehensive plans and the difference between Medicare and Medicaid and what works best for you, it's very individualized. You don't want to be overpaying for services that you're not going to be rendering within those years. You don't want to be underpaying for services that you will end up needing. And it's very particular to what you need and to the people that you're caring for. Between the ages, I'll share a personal anecdote. Between the ages of 26 till about 30, I went without insurance and paid solely out of pocket for my yearly exam and for one other clinical exam because it only cost me about $650 a year versus how much I was offered to pay for an insurance plan because of how much income I make. But the means weren't going to meet, the ends weren't going to meet the needs if I had signed up for whether it was a commercial plan or a plan with my job at the time. So I had chosen for myself to go without insurance and pay for my own items out of pocket and engage in those sliding fee scales that other agencies really offer for those that are uninsured, that are choosing not to be and still be self-paid. And then tap in with your employer. A lot of times you can have more than one coverage. Be careful with that too. What we found is that if you are uninformed about how the system is, you could get multiple phone calls from multiple different insurance agencies, and then you have a commercial plan with Molina, but then you also have a good plan over here. And then you have a whole bunch of insurance cards, and you don't know what's covered or not covered, and oh, I didn't sign up for dental, but I have all of this medical coverage. The coverages are so specific for dental, medical, and vision, and even mental health. Mental health coverage is very like here and there, depending on what you're seeking and what you need. There's a lot of hoops that people tend to jump through. So when it comes to comprehensiveness of the health insurance, it really goes based on the individual, because who you have and who you're caring for is going to impact what your need is at the end of the day.
I think the only thing that I've had excellent job of explaining is that there are brokers through the exchange, there are brokers who come on site to our organizations that can help you navigate and answer questions that you may have so you can find the coverage that's right for you. Because I do agree it is all individualized and individual based. You may not need everything, so why pay for something that you don't need? And then educating people on the process and the system, because Medicare and Medicaid are different. They're different, and there are different rules, there are different coverages. So just making sure that you understand your insurance plan as well can be helpful. And in terms of connecting with services, when you do connect with organizations that can help you, they can also connect with the Office of the Aging, who will then connect you with PACE or other programs that may provide additional supports for people who are aging and elderly, would like to remain in the community. I think that when we're talking about knowing what services are out there, that's why it's so important that we have conversations like this so that we can educate the community, so that you do know what's out there, so that you can share it with community out there, so there's more knowledge so people can access the services.
My next question is, how do people know about you?
All right. I think that how people know about us is doing things like this, focus groups, being out in the community, like Alex mentioned, going to different fairs, holding events at our agencies, advertising. And I think just having a community presence and also surprisingly word of mouth, right? How we show up and what Alex and I have been talking about in our organizations is how we treat people when they come through the door, how they feel about their experience. They go out and they share that with others. I had a good experience here. I like that, you should go. Or I have a therapist that I like. Or, you know, I saw a doctor, primary care, and he was great. All of those things really help, I think, outreach into the community. So it's about the work that we do, ensuring that we're doing good work. And I think also just having presence in the community and connection. One part of CCHCs is that we're strongly encouraged to develop partnerships. So partnerships with other organizations who do the exact same thing as us, or maybe have an arm of something different. Like, for example, Liberty Resources has outpatient SUV treatment, but Helio has inpatient SUV treatment, and they have more expansive services. So we partner with them to ensure that our clients, if they need something beyond what we offer, that we have pathways to connect them. And the same thing with other community resources. So I think it's when we talk about access and the underinsured and making sure that people have connection to healthcare, it's all of our responsibilities to do that. And we work together, then our community can have information and access to services.
Thank you. We're on LinkedIn, we're on Facebook, We have a website by our full government name, SyracuseCommunityHealth.org. We have job opportunity QR codes. We have a lot of partnerships, collaborative organizations such as Rescue Mission, where we have a quick care center through Blueprint 13 that we have present on our location. We'll get engaged in community health fairs, such as in the city. We work with Syracuse City School District. Being embedded in the community is the best way people can know about us. But really the best way that it spreads is by word of mouth, and really by, this sounds really silly, but like by our shirts, or by our garb. So we have like local t-shirts. I'm not wearing one now, but I'm wearing like my zip up. I encourage my staff, even though it sounds really corny, that you don't have to wear your SCH t-shirt only when you're at work. You can wear it when you're like going grocery shopping or doing your stuff. Because it's about getting that logo out there and about getting this sort of like image out there too. Just as Yolanda said, when you have a positive experience, you're gonna talk about it. Same thing goes if you have a negative experience. If you have a bad doctor's appointment and you're going to the grocery store right after and someone says, how was your day? You're like, it was awful, I had a bad doctor's appointment at non-Syracuse Community Health Center. So that's one of those things where like you're more likely to spread the bad news, and that bad news is gonna spread between 10 people. And when you spread the good news, that good news is gonna probably sit and die with one person. Because it was good, it was great, I went here and we were done. And then that leaves. But if you have a bad experience, you're telling the postman, you're telling the grocer, you're telling your husband, you're telling your daughters, you're telling your auntie, you're on the phone with your friend in Texas, and you're saying, you know, I had a terrible time. And that's really where the workplace culture for any center, any clinic, any foundation organization, if you're not reachable to your constituents, to your patients, to your clients, if you're not engaging back with them, you can have the most robust marketing team ever. You can have the prettiest building and the prettiest items, but if you're not really tapping into them as a resource and engaging with your patients on a human level, they're gonna say that you're not really putting your money where your mouth is. You're not performing to the standard that you're trying to hold yourself to. And so you really have to show up and show out. Find us at the Syracuse Workforce Run on Onondaga Lake. You know, we will have, I'm aiming, if all of my team, I have 22 staff. If all 22 staff attend, I'm gonna release a photo to them of me running last year's event where I look all crumpled and tired. But I don't wanna give them that photo, that's their incentive to try to get everybody on the team. Because if I can get them engaged into an after work item to go and have some movement, and we're all wearing SCH shirts, it's not just us that's celebrating each other and the work that we're doing and elevating ourselves to increase that level of patient care. It's all the other communities and agencies, from Key Bank to Liberty Resources to Rescue Mission to In My Father's Kitchen to St. Joe's, that are also seeing us show up and show up for the community. So it's really that engagement. Also look into your local resources. 211.com is a really good resource to learn about other agencies that are in the community, not just us. You can also look on events.com. There's a lot of community partners that will go and make their like sessions and programs on events.com, or you can find them on Facebook events. Start digging. Next door is a little tongue in cheek. It's kind of like too candid of Facebook, but you can find events on next door that like your neighbors are talking about and saying. Get connected with professional partners on LinkedIn. That's where you'll really hear the buzz of what's happening behind the scenes of the movers and shakers that are actually building and running these departments. And you can get right in their DMs and inboxes and be like, you know, this is something that I'm interested in as an advocacy standpoint. If you get involved in volunteer programs, it allows you to be part of that mission, be a part of those programs too. And then you can feel a sense of pride because you're just as involved as the people that are here.
Great, thank you. So that was great. I mean, so I will say, as far as our foundation, you know, we don't work directly with the community, but say with wholesale and retail. However, our community that we work with and serve really are the community-based organizations in our 16 counties. And I think, you know, when we think about how people can engage, it really is engaging with those organizations. And I think that both Yolanda and Alexandria both were talking about it. It's the need to be in the community. For us, you know, we recognize how important the nonprofit organizations are and what they need to be able to be in the community. And when we say communities, we also talk about health equity, that it really is about all communities. and making sure that underserved communities are represented and that they are able to be and have access, right? So we talked about different languages and having culturally competent materials. Those are all very important. But that also takes funding for these community-based organizations. It's awfully difficult to be able to do that outreach and that without having that, the funds in order to do that. One of the things that we recognize, this started in COVID and it's still happening now, is that a lot of your nonprofit organizations out there are having a very difficult time with growing their services when their budgets are such where they're having difficulty maintaining their general operations. And that's something that we are looking more and more at, is how are we able to help support organizations for their general operating support and their capacity to be able to deliver these services. And that outreach is very critical, so that people in the community know what services are available, what can be helped. 2MO, was mentioned, is a great source for our older adults and people with disabilities. There's a New York Connects that's out of the Offices for the Aging. I would think those would be your two kind of go-to, resources to learn about services in the community.
I think you pretty much addressed this, but we had a question from the audience. What strategies are being put in place to change the narrative around the health center?
Yeah, I think you were pretty much there. I can reiterate though, so the strategies that are put in place to try and change the perception of the community health center. We have generations of culture that are embedded in specifically Syracuse Community Health Center. Syracuse Community Health Center is the one that I can speak mostly on, but when in the 1970s, when federally qualified health centers started popping up in different areas, the focus was really to tap into healthcare for urban, highly centralized, populated communities, and also rural areas. So there was a push to bring hospitals and ambulatory outpatient health centers to areas that have less accessibility than others. What that caused in the long run, after about 20 or 30 years of them being involved, was this perception of what a community health center was for and the type of population that the community health centers were serving. And what that perception was that, well, you could go to a nicer hospital. And those that were coming to the community health center often felt that, well, this is the hospital for them. And it was that sort of mentality that also brings a barrier to care. When you don't feel like you're getting that top echelon of service, that white glove level, and that's just what's allotted to you, that's what's available, it makes it even harder to be involved in. One of the examples of the strategies that we've done is really try and bring modern medicine into our practice. And some of that comes from the visuals. If you look around the room here, we have a lot of pastels, a lot of bright colors. If you're in our waiting room or our lobby, we have a lot of natural light. We have art, murals, modern music that are in the waiting rooms and not music. So that way we still have that sort of quality of the community that's present in our health centers, but it's more open and bright and welcoming. We're doing something similar at 819 because we're expanding family medicine back upstairs as a part of our IFS and our population health, where we're trying to close those gaps. But we painted the walls a fresh color white. We've painted the walls downstairs a similar green in our quick care unit to kind of bring that bright light. We've made all of our lights, rather than some of them being warm toned and some of them being blue toned, they are all now a cohesive LED fluorescent, but an LED fluorescent, so it's not that bright halogen-based fluorescent that really gets you going in the waiting room. These are certain levels that tend to be overlooked, but when you're a patient coming into a health center, it feels so much more welcoming. It feels so much more higher quality because the environment that you're surrounded by. If you were to come here, you have skylights walking down our hallways and you're guided to your exam room. So you have these little pops of bright light or gray light, because we're in Syracuse. You have these little pops of light that allow you to feel a little bit more welcomed in your practice. And one of the things that we're actually getting combated with right now is, since we're navigating family medicine back over to the 819 building, we have a certain patient population on this panel that has been coming to the 930 building. We're now 2 years old in this building. They've been coming to this building for about 2 years, and they go, I have to go back to the old building. And so we're saying, we've revitalized, we've renovated, it's the same quality of service that you would get over here, and your provider's the same. He's just over there now. So that way we still have continuity of care with the same provider. We've revitalized the rooms or renovated the rooms so that way they feel similar or brighter. But you do kind of get the curse of that building a little bit because it was 3 different department stores that were combined into one in the 70s to make it work. And it very much feels that way. It feels the age that it is, which has a good quality to it if you're into that aesthetic. But if you're seeking a certain level of care, sometimes the building matters. I have individuals that don't want to go over to the East Clinic because of the locale that's there. I have individuals that don't want to go to the West Clinic because they know too many people in that community and they feel like that they'll encounter them in the waiting room. So it's really tapping into that patient and see what they need. Do they have a building preference? Do they have a provider preference? And what are the strategies that we can do to try and undo the stigma that has happened for community health centers so long? Some of that comes from my staff too, especially front end. Sometimes the front end staff can be a little bit too casual or too casual on the phone and their tone can come across. And that initial perception can make or break the relationship of really making people say, you know, that's why people say this about community health centers. So those are always threads that we're trying to pull away, but it can be hard. It's a cultural mindset.
You got something? Please go.
Yeah, one thing that I would just add that we're trying to do is one of the strategies is to get community feedback. So we have a consumer advisory board that is comprised of individuals who receive care at Liberty Resources, or they have family members who know someone who receives care. We meet quarterly and we share things like our policies, right? So we can get feedback on what works. We ask them about like what we're thinking, initiatives, workflows that we're thinking of rolling out, marketing, to get real-time feedback. And I think that that helps. And I think that it also says that your opinion matters. The care that you receive, you want to make sure that you have a say in that. And that's one of the strategies that we implemented last year. And it's been very positive, having people involved in how we organize and structure.
Last question for each of you, sort of getting at your pet peeve. What is one change that would make you very happy and would make a big improvement to the system?
I think that one change would just be less complexity. There's so much red tape. There are so many, we talk about many barriers that prevent people from getting care that they need, that make it harder for us to give care to individuals, that tax the system. And if we could just remove some of that, I think that we would have more people engaged in care and getting, the help that they need. So I think that's one thing.
There's a lot that I would change, but I also don't, I'm not a big proponent of change either at the same time, because I feel like consistency breeds comfort. And when we try to, there's a lot of conversations that in order to make a better system, you have to dismantle the system. Which at the end of the day, systems outside of our particular system, the very unique United States healthcare system. It's not to say that everyone has better or worse. Everyone's is unique. Everyone's is different. But the idea of dismantle in order to rebuild is always a very uncomfortable challenge for myself when it comes to talking with patients or talking with clients. I like something where one thing gets phased out and something gets phased in, and that other thing is still present for a little while. So that way there's not hard cutoffs and hard deadlines and all that red tape. When there's a lot of change, it makes my job a lot harder. So the one thing that I really focus on, though, the bane of my existence or my pet peeves, is phone accessibility. Being able to reach the locations that you're trying to reach. It's part of what has been given to me as the strategic plan for 2025 is to really change Syracuse community health specific phone system, because we're, for lack of a better words, terrible at it. We will return your call. We will probably not answer your call. I'm so sorry. But we get an influx of about 3,535 calls within a month. And with 22 front desk staff and 204 staff total with 13 departments, not all of those 3,000 calls are leaving voicemails. So if you call and no one has answered you and you get frustrated and you hang up, that's fine, but then we don't have the opportunity to follow up with you, and so then that's a misconnection. But that's a failure on our part because we didn't answer the phone when you were initially calling us and trying to contact to us. So it's one of like, even though it's a bane of my existence, it's a passion of mine too that I really want to remedy and solve. Because as I talked about earlier, a lot of agencies are saying, oh, just let AI do it. And I'm anti-AI. I know it's good for business. But I'm very much like human power. So like if we can get that warm touch on the phone, it's going to be a better perception for the patients. The patients are already experiencing AI when they're navigating the commercial plans. They're already experiencing AI when they're trying to go and talk to chatbots online. They're experiencing AI in every facet of their life so far. What can I do, or my team can do, to really bring that quality back into the telephone system to bridge that accessibility? So that way patients don't have to feel like they have to show up in order to get answers, or they have to have one specific extension to call somebody. That's what I would change.
Can any change from you?
This is tough to pick one. No, I mean, I guess I just, back to everything that was talked about earlier. I mean, it just to simplify it, every person has a right to healthcare. Everybody deserves healthcare, and if every person can get the help that they need to be able to access the coverage that's best for them, and that takes every one of us in the room, you know, our partners, public and private, but there is a lot of services that are out there. There's more that are needed, but people need to have the ability to access and understand what services are available to them. And I think that's something that we all need to keep working on, is making sure that those who need the care most get it.
Thank you. Yolanda, Alex, and Ken, this has been wonderful. Let's give them a round. As usual, over the next couple of days, we'll have a version of this, a recording of this on our website. And it'll be there along with the many, many others that we have there. So please feel free to share with others once it's up. We also, we are always looking for donations. So there's a little box there. If you've got a $5 bill or $10 bill, we would very much appreciate it. We also are a nonprofit organization that sort of sometimes lives on, what's the term of, just been on the prayer or whatever. Anyway, thank you so much, everybody, for being here, and hope you have a great weekend. Thank you.